Hi, it's Georgie, and this is Fempower Health Audio Insights, where I break down the biggest issues in women's health so you can navigate the system with confidence. Whether you're a patient, policymaker, or provider, these insights give you the power to make informed decisions. Today's topic is about AI and how it's shaping the future of medicine, but we have an important question to ask. Is it failing women? AI promises to be the great equalizer in medicine, faster, smarter, more precise. However, AI is only as good as the data it's built on. If the data is flawed, incomplete, or biased, then AI won't fix healthcare, and instead it will automate the same problems we've dealt with for decades. We already know the healthcare system is broken. Women have been left out of research, dismissed in medical settings, and underrepresented in leadership. Thus, if AI is learning from this system, we have to ask, what exactly is it learning? The answer, a deeply imperfect past. So, when algorithms inherit decades of bias, it's women's health that pays the price. So let's talk about three important examples. First, we start with heart disease. It is the leading cause of death in women, yet AI models trained on male-centric data fail to recognize women's symptoms. Women are 50% more likely to be misdiagnosed after a heart attack and 50% more likely to die within a year. In the next example, it's about bacterial vaginosis, otherwise known as BV. Machine learning for BV performs worse for Asian and Hispanic women, according to one study, proving that AI is only as accurate as the biased data that it's fed. And then lastly, women weren't included in clinical trials until 1993, and today only 1/3 of studies analyze data by sex. So if AI isn't trained with diverse, sex-specific data, it will scale these blind spots into the future. But the issue isn't the AI itself. It's that the foundation of data is fundamentally flawed. If past research has overlooked women's symptoms, then AI will too. If diseases that disproportionately affect women, like autoimmune disorders, osteoporosis, and chronic pain, have been underfunded, AI-driven healthcare will reflect that same lack of attention. And here's the real danger. Once an algorithm labels a woman's symptoms as psychosomatic or calculates that she's at lower risk for a disease because of outdated data, that mistake could get locked in. It stops being a judgment call and starts being an objective, data-driven decision, even if it's based on the same faulty logic medicine has used for decades. AI won't fix healthcare overnight if we don't change the foundation. How research is conducted, who is represented, what gets funded, then AI will continue scaling these same biases we've been trying to undo. And this dynamic then snowballs into healthcare reimbursement models. So why are reimbursement models failing women's health, and how exactly does AI fit into this? So even the best technology won't change healthcare if the financial incentives remain broken. So let's take hysterectomy as an example. Hysterectomy is one of the most frequently performed surgeries in the U.S., despite the American College of Obstetricians and Gynecologists, otherwise known as ACOG, stating it should not be the default treatment. Yet insurance often makes it easier to get reimbursed for surgery than for less invasive options, which could include hormone therapy, pelvic PT. Even within hysterectomy procedures, however, reimbursement trends don't align with best medical practices. Minimally invasive laparoscopic hysterectomy rates have dropped, not because they aren't safer, but because reimbursement often favors other approaches. So if AI is layered on top of this broken system, it won't drive better healthcare. It will optimize instead for what gets reimbursed, not for what's best for the patients. So let's take a real-world example, the menopause care gap, and how AI reimbursement and research must align. So we've seen what happens when bad policy and misrepresentation of research shapes women's health care. And if you haven't heard this, In 2002, the Women's Health Initiative study was widely misinterpreted, leading to fear-driven reduction of hormone therapy prescriptions. Doctors stopped prescribing hormone therapy even when it was the right treatment. The result? Millions of women suffered from preventable health issues like osteoporosis, brain fog, and cardiovascular disease. A generation of women was left untreated, not because the care wasn't there, but because the system failed them. Now imagine AI being built on flawed data, outdated research, and broken reimbursement policies. So, if we don't fix these issues first, AI will reinforce decades of harm, not solve it. But there is hope. So, how could AI transform women's health? And again, we don't want to just talk about problems. There's actually real hope if we get this right. So now let's imagine a future where clinical trials, FDA approvals, medical guidelines, and reimbursement all align seamlessly, and where AI accelerates progress, not by scaling old biases, but by leveraging high-quality inclusive data to drive faster and more accurate decision-making. And where conditions like endometriosis, where women now wait 7 to 10 years for a diagnosis, are identified in months, not a decade. And where the 17-year gap between research and clinical practice collapses into months, ensuring breakthrough discoveries reach patients sooner. That's the future AI could help create, but only if we fix the foundation first. So, if the data is incomplete, AI will scale those gaps. If reimbursement rewards outdated interventions, AI will optimize for the wrong things. And if clinical trials still exclude women or fail to analyze data by sex, AI will reinforce medical blind spots. So what's the call to action? What needs to happen now? The good news, this isn't inevitable. We can fix it. So we must demand better data. AI models can't be built on incomplete research. Sex-specific data and diverse clinical trials must be standard, not optional. And we must invest in women's health as an economic and public health priority, not just fertility and menopause, but Alzheimer's disease, autoimmune disease, cardiovascular health, and beyond. And we must ensure AI-driven healthcare aligns with reimbursement and real-world clinical practice. If doctors can't get reimbursement for treatments AI recommends, the system still fails. Technology is a tool, not a solution. And the future of healthcare must be built with women in mind, because if we don't change course now, the next generation will face the same barriers, only harder to challenge. So if you'd like to continue this conversation and other dialogue like this, please join the Fempower Health community. You can see a link in the show notes, or you can go to the Fempower Health website at fempower-health.com, where you'll find more details and a link to apply. This is a private community where we want to make sure the right people are at the table having these conversations. It is not about getting jobs. It is not about selling your products. It is a conversation to move women's health forward. So thank you so much for tuning in today, and have a wonderful day. Thank you for joining me today on Fempower Health. If you'd like to continue the conversation, please follow me on social media. I am most active on Instagram, LinkedIn, as well as TikTok. You can also subscribe to the weekly newsletter if you want to stay off social media to get the latest and greatest updates. And you can find the link to that either on my website, fempower-health.com, which is a hub to all the different health topics I've covered over the past 5 years, or you can go to the show notes where there's links to all the helpful resources that are relevant to this discussion. And if you know of someone in your life who would benefit from this information, please do pass this along, because that is how we can ensure this important information reaches those who need it most. And for anything that is discussed medically, please understand that none of what we share on Fempower Health is medical advice. It is all for information purposes only, and only a conversation between you and your doctor can give you the care that you need. Thank you very much.